Okay, for body organization, there are two subparts to this chapter. The introduction, as far as just anatomy terminology to get you familiar with the concept of anatomy, physiology, and overall where we stand to begin this course. The feedback loops, and then we'll talk about additional terminology, being the terms, body terms, regions of the body, as well as cavities. So for part one, this is a list of things that we're going to be going through with regard to the introduction and feedback loops. Anatomy is really about the structure, where physiology is more how that works. Some of the subspecialties we need to be aware of are cytology. Cyte means cells. Histology, we're going to spend a lot more time learning about histology. A significant part of histology is in the next chapter, which will be tissues. Embryology. So these are just some examples of subspecialties within the anatomy physiology field. There are certainly more than these. So from complex to simple, and I think it's easier to go from simple to complex. So let's start at the bottom of the page, and this is how our bodies are organized. Start with the basic elements, which are atoms. You get a couple of those together, that becomes molecules. Molecules then can be formed to create organelles, which are subgroups within a larger cell. Common cells are grouped together in tissues. We will learn about the four main tissue types in the next chapter. Tissues are then organized in such a way to create organs within our body, and then our organs are associated with specific organ systems, or it's just sort of a way that we're grouping them in our body to ultimately be the organism. So this is a pictorial version of what I just said. We start at the smallest level of atoms, they become molecules. I didn't mention macromolecules earlier, but they become organelles, which go to cells, then tissues, become a single organ, which is part of a larger organ system, ultimately to be the organism. Homeostasis is a way of keeping the body in check and keeping our body within its normal ranges. 98% or 99% actually of our systems utilize a negative feedback loop. The negative feedback loop is something that is like a temperature, which is like your thermostat in your house. Negative means that it will, when something deviates from the norm, say you have a normal body temperature and you get too hot. You deviated, you've gone away from your normal level and you've gone outside of your range that your body's comfortable with. The negative feedback loop would cause you to sweat. Some of that heat dissipates and leaves your body, and then your temperature comes back to normal, and then the sweating stops. So that's the negative. It turns it back off when you've gotten back to normal levels. Blood glucose is another example. Perhaps you ate a whole bunch of jelly beans and your blood glucose goes high. It's going out of range. Your body will sense the high blood glucose levels. It's going to tell your pancreas, tell insulin to take that glucose and send it to the cells so your blood glucose levels come back down to be in the normal range. And then it turns off the pancreas and shuts off insulin and once it's back to normal. So again, a negative feedback is about turning on a mechanism to fix something, and then it turns it back off again. Positive feedback is a less utilized mechanism of our body. The two main examples are blood clotting. That would be if you have a cut in a vessel. And from the view of inside the vessel, you're going to see an exposed vessel wall. It might have collagen, other binding components. A platelet will stick to that. When one platelet sticks, it becomes stickier and causes additional platelets to stick on. So in the positive feedback sense is you have a system, something that happens and it is augmented. More and more and more will happen until finally that cut is sealed over. Uterine contractions, the other example, say a woman is pregnant, goes into labor, she feels low level of contractions, very infrequent. And then the presence of one contraction actually stimulates the development of a second contraction, which will then stimulate the development of a third, and the duration between them becomes smaller and the intensity of them become bigger. So this is a positive feedback in that it's building on each other. So you really need to understand the difference between a negative and positive feedback loop. So negative feedback is really negating or counteracting the original stimulus. You have too much glucose, we're going to do something to bring it down and bring it back to normal. Positive feedback means we're going to augment or enhance it. So you start an early contraction, the next one's going to be bigger and stronger, and the next one's going to be even more forceful than that. And that's a positive. So it's going to amplify. On the positive feedback side, it will amplify all the way until a specific endpoint. In the case of labor and uterine contractions, that's when the baby leaves the body, and then the contractions will cease. In the case of blood clotting, it will accumulate platelets on a cut until there's no more exposure of vessel wall materials. So it's amplified, but until a certain point. So this is written out in a more descriptive way, what I just said earlier about negative feedback when something's out of range, the body's trying to put it back in range. And it's the most common form of control. And the positive feedback is going to be augment or enhance. The basic components, if you're trying to put this sort of on a computer analog, is you would have a receptor that receives the information, the stimulus. The stimulus could be the person is too hot, and it's a temperature sensor, or it could be a chemoreceptor that says we have too much blood glucose. That's the receptor. It receives the information that we are out of bounds. The control center is then really going to process how we're going to fix this. What do we need to do? And then the effector is really what's going to happen, whether it is the hormone that's putting glucose away and lowering blood glucose, or it's a mechanism going to our sweat glands so that we will lower our temperature. This image shows that the negative feedback, we start with an increase in body temperature here. Body temperature, we can see in this graph, is going up and up and up. And so the brain has it as the hypothalamus, but you need to just notice the brain, there's an element in the brain that senses this high temperature. And so therefore it elicits mechanisms to bring the temperature back down. That could be making you want to, roll your sleeves up, or making you sweat so that you're going to remove more of your body heat. If your temperature goes lower than normal, the brain, hypothalamus in the brain, is going to see that, and it's going to then elicit mechanisms like shivering to raise it back up. So we want to bring everything back towards that midline and not deviate too far away from that. This is a little bit more detailed where you have the action. This is a change away from normal. So this would be person's too hot. Temperature has gone away from normal temperature. The receptor, in this case, a temperature receptor, would identify the temperature as too hot. The control center is the part in the brain that identifies it as too hot and then sends information to the effector. Let's stimulate the glands, the sweat glands, and therefore the sweat glands, the action is to then secrete sweat, and therefore heat gets dropped, and then you're going to go back to normal. And you're going to ultimately turn off those sweat glands again. This should be in your notes, and it is just a step-by-step guide with regard to blood glucose levels and the negative feedback, and how you are going to increase the release of insulin. But ultimately at number 5, the negative feedback part comes when you're going to stop the insulin release once you've achieved normal levels again. This shows the positive feedback, ultimately where you have, in this case, a break in a vessel wall. Damaged cells are going to cause clotting. Those platelets are going to then clump together. But the platelets, once they stick together, they then release additional factors that causes even more platelets to stick. So that's going to enhance or augment the sticking. So you have a whole lot of platelets that are going to clump together to prevent the vessel break. So you should be comfortable knowing how we are built, how we go from really simple elements like atoms to molecules to organelles to cells to tissues to organ systems, and then the organism. You should know the difference between a positive and negative feedback loop, and you should also be able to know how we maintain those limits, what we do to turn on and turn off, and ultimately get back to normal levels. This second part of this chapter, you're going to know about the terms and regions and different cavities, as well as serous membranes in our body. Here is a diagram where you can see, if we look up close, you'll see every region of the body has an anatomical term along with the layman's term. So for instance, if we look at the very bottom on the back-facing diagram where we see plantar, that means the sole of the foot. The heel is called the calcaneal region. You can see the back of the knee is popliteal. You need to know the terms that are in the bold, for instance, like popliteal or lumbar or gluteal or olecramal, carpal. Those are the terms you're going to need to know, as well as the region of the body they're associated with. I may ask on a test, I may give you the regular terms. Tell me the name of the upper arm, or what is the sole of the foot called? And you will have to supply brachial for upper arm or plantar for the sole of the foot. Or you may see a diagram with arrows pointed to regions, and then you're going to need to identify those utilizing these anatomical terms. The anatomical position in anatomy is a person usually lying down, toes up, so you're like kind of standing up, not flex, but just normal standing shape. And the most important part is your palms are going to be facing forward with your thumbs outward. This anatomical position is important because in your forearm you have two bones that when you're in anatomical position with your thumbs outward, now that is not your normal standing position because our body tends to rotate our hands inward. That's not anatomical position. You have to have your hands pointed outward, and with them outward, our two bones will be parallel to each other. I'm going to put this here on my hand. Here, you would have one bone here to be in the radius, and this one, the pink, the ulna. If you're in the normal position, these actually will form an X. And so anatomical position is very important because the two bones of the forearm need to be parallel to each other. Supine means you're just lying down, your face up. Prone is just the opposite to that, where you're lying down, but you're face down. There are four main abdominal pelvic quadrants. However, the abdominal pelvic regions that looks like a tic-tac-toe board on someone's abdominal cavity or on abdominal surface is the main one that I need you to know. There are 9 specific regions. The upper middle is known as the epigastric, meaning above the stomach. You have the umbilical region, which is going to be the center. And the lowest central portion is the hypogastric, meaning below the stomach or pubic region. The middle portion on either side, so it's about where your waist is, are going to be your right lumbar and your left lumbar. The upper 2 regions are known as your right and left hypochondriac region, just like the bottom 2 regions are known as your inguinal region. So for instance, your appendix is going to be located in your right inguinal region, where the majority of your liver will be located in your right hypochondriac region. In this image, you can see sort of a see-through view of the body where you can see some of the organs beneath the checkerboard, so you can see where they would be located. The directional terminology are utilized in a sentence, and you do need to know how to use them in a sentence. You'll definitely be asked that on your exam. They are utilized in a sentence always in reference to something else. You don't say, the top of my head is superior. It always has to be in reference to something else. You can say, my nose is superior to my chin. So it's always something in reference to something else. Superior and inferior, sometimes known as cranial or caudal, meaning head to tail, are often or most commonly referred to with regard to the torso. So if you're looking, say, your belly button, you can say my belly button is inferior to my sternum or inferior to my neck. Anterior and posterior, also known as ventral, which is the front. Anterior is the front, so is ventral. And dorsal is the back, and this is the same as posterior. So you can say, so anterior, posterior generally refers to just which side you are referring to. Medial, lateral, that means if you're medial, you're going closer to the midline. Lateral, you're going farther away from the midline. So you could use an example of saying your ear is lateral to your nose. Proximal and distal refer more to your limbs outside of your torso, to the legs and to the arms. You would say the elbow is proximal to the wrist. It means proximal means closer to the torso. Distal means farther away from the torso. So the elbow is proximal to the wrist. You could say the knee is distal to the hip. You would not use superior and inferior on your limbs. You would not say your hip is superior to the knee. That is incorrect. You would say the hip is proximal to the knee. So when you refer to use limbs, you're going to utilize proximal and distal. When you're talking about the torso, you're going to use superior and inferior. Then there is superficial and deep. If I were to ask you to use these terms in a sentence, these directional terms, you wouldn't say the cut is deep. That would be wrong. You can say the heart is deep to the ribs. You can say the sternum is superficial to the heart. You could say the belly button is superficial to the intestines. Again, the term is referencing one location with regard to another location. And finally, always make sure you utilize right and left, but it is the patient's right and left. And this will be a really important concept when we get into talking about bones and we're identifying specific bones. Just because you're looking at it and it looks like it's your right, it's whatever bone and it belonged on the patient's that you're going to have to identify. So we'll address that as we come along to some of the subsequent chapters. The divisions of the body are if you were to slice through a body with a humongous guillotine. There are three main slices. If you were to take a guillotine and you were to slice me straight down, where it's this way, the paper would be this way, and that the whole front surface of me is not disturbed, and say it falls forward and you just see my outline, that is a frontal slice. The frontal slice can also be known as a coronal slice. If you were to change the guillotine to go forward and back, and it were to slice my body straight down so that the right and left sides were to separate from each other, that is a sagittal slice. And finally, if you were to go horizontal and just slice me so that I have my top and my bottom half are separated, that is a transverse slice. We can see these images in this here, where we can see the frontal or coronal slice, where you see in a whole frontal surface. The sagittal is across the side, and then the transverse is down across a horizontal cut across the body. If you can think of what slice this is, it is transverse. Now, the body cavities are these spaces within the body. So there are these two large body cavities, one being ventral, that's the front one, and that in this picture is sort of a yellow color, and the dorsal meaning back. So the dorsal cavity is the easiest one because it's only divided into two sections. We can see the dorsal is divided into the cranial, where the brain is, and spinal, where the spinal cord is. And you can see those represented in green on this image. The ventral body cavity is in the front, and that is going to have several subdivisions. We can see the ventral body cavity is divided into the thoracic and the abdominopelvic. There is a diaphragm, which we use to breathe, that is almost halfway, a little higher than halfway, and that above is going to be the thoracic cavity. Within the thoracic cavity, we have the pleural, which is where lungs are, pericardial, which is where the heart is, and mediastinum, which is just the in-between space. In the lower portion below the diaphragm, we're still in the ventral cavity, but we have the abdominopelvic. That's where we have the abdominal cavity, and then an imaginary line that really starts at the edge of our pelvis. Below that is our pelvic cavity. So they're really considered, if you want to cover all your bases, the abdominopelvic cavity. In this image, we can see the dorsal cavity is depicted in the brighter, the orange, where we can see cranial for the brain and vertebral for the spinal cord. So both of those are the only two things in the dorsal cavity. It is the ventral body cavity that gets a little more complicated. So we can see the thoracic cavity has on the slice, the frontal slice of the person, we can see the two purple pleural regions, that means the lung area. We can see the turquoise area for the heart, and then the orange, the lighter orange, is just your mediastinum. All three of those areas are in the thoracic cavity, which is part of the ventral body cavity. And then down below, we just see the red and the green. That's the abdominal cavity and the pelvic cavity. You can see this written out again. Cranial cavity is going to be in the skull, and the vertebral cavity. These are the two subsets for the dorsal cavity. For the ventral cavity, the two subsets are the thoracic and the abdominal pelvic. But each of those has a further subset. Thoracic has the pleural where the lungs are, pericardial where the heart is, and the mediastinum is the in-between space. Abdominopelvic cavity, we have the abdominal cavity that I have written first in the first bullet item, and the bottom bullet item is the pelvic cavity. The two in between, peritoneal and retroperitoneal, they are another subset that you do not see on this diagram. Our guts that are in our abdominal cavity are actually located inside a sac or a bag. This bag is known as the peritoneum. So the peritoneal cavity is actually the bag in the abdominal cavity that is holding our guts. Our kidney, for example, is not in that bag. And so it's known as retroperitoneal because it's behind it. It's in the way back. So that brings me to the discussion of our serous membranes. A serous membrane is this bubble or sac that is around three locations. The first is our peritoneum, meaning our guts. We have a serous membrane around our guts. We have another serous membrane around our heart, and then we have one around each of our lungs. A serous membrane is just like, it's a double membrane, technically a double membrane, but visually only looks like a single membrane. The picture here, you can see a fist punching into a balloon. So if I were to blow up a balloon, blow it up, and punch my fist down into the balloon, the area of the balloon that is actually touching my hand or touching that the organ, see if you're in the case of the heart, it's a little bit off from my drawing, is going to be the visceral pericardium. So the whole sac is a pericardium, but the important term here is going to be visceral. The portion that's going to be the outer area, and so here in the case of the heart, when I have this in green, is going to be your parietal pericardium. So if a surgeon were to open somebody's chest up, they're going to cut through the sternum, they're going to retract the ribs, and instead of seeing the heart right there, you're going to see a bag that the heart is contained in. What you are seeing from the outside is going to be this parietal pericardium. The cardiac surgeon will cut right through the parietal pericardium, and then you can see the heart. The question you might say is, well, what about the visceral pericardium? The visceral pericardium is actually infused and the same as the surface of the heart. So clinically, you only visually see one layer, that is the parietal layer. But technically and histologically, the second layer is actually adhered onto the surface. So the visceral layer is touching the surface of the organ, whether it's the lungs or the guts or the heart. So we can see the three serous membranes. So technically they're double membranes. Clinically, they just look like one membrane. The pleural membrane that we see here is going to be around the lungs. The visceral pleura is going to be touching the lung directly, where the parietal pleura is going to be this sac around the lung that if you were to open up somebody's chest, you could touch and see the parietal pleura. The visceral pleura is just on the surface of the lungs. It just seems like it's the lungs. The peritoneum, this here is going to be our intestines. So we have a parietal peritoneum, which is the sac in our abdominal cavity that our intestines are contained in, and the visceral peritoneum is actually touching the surface of our intestines. And finally, we have the pericardium, and the pericardium is what's going around the heart. The visceral is going to be touching the surface of the heart, where the parietal is really the sac that a surgeon would have to cut through to be able to view the heart. So for this chapter, you should know all the surface parts and terms for the regions. That's the body shape that uses the anatomical terms, like the elbow being olecranon or chin being mental. Those are the terms. You should know the layman's terms, chin, and you should know the anatomical term, mental. You should know the body position, that it requires your palms up and your thumbs out. You should know about the abdominal regions. So we're going to be more specific about the regions. We're looking at epigastric, right and left hypochondriac, umbilical, right and left lumbar, as well as hypogastric and right and left inguinal regions. Then you should know the directional terms. So where to utilize proximal and distal, how to use them properly in a sentence, superior, inferior, anterior, posterior, so everything from that list. Be able to use them in a sentence and know what they refer to. Then the divisional planes, be able to know the different slices of the body. If I were to say dividing a body into right and left halves requires what slice? That's a sagittal slice. Dividing the body into a front and back half, that would be a frontal slice, or a top and bottom half, that would be a transverse slice. And then you should know about the body cavities. We have the dorsal cavity, which only has two subsets, and the ventral cavity, which is a little more complicated, has several other subsets. So you should be familiar with what organs are within each cavity, how each of those cavities are divided. And finally, you should be comfortable knowing about the double membrane known as the serous membrane. What's in it? What's the visceral part? Tell me the parietal part. You should know the one around the lungs is the pleural, parietal pleura or visceral pleura. The one around the heart is going to be either your visceral pericardium that's on the heart or parietal pericardium, and which is going to be what you would cut. It's a sac that is contained in the heart. The intestines would have the parietal peritoneum that you would cut through, and then the visceral peritoneum is actually touching the surface of the intestines.